things that's so unusual in Colorado is the culture of collaboration in our philanthropic community, and the fact that the Colorado Health Foundation, the Colorado Trust, Caring for Colorado, and the Denver Foundation came together on this behavioral health project and this report because they all identified this as an area of concern, a place where they needed to invest some dollars, and they said it's going to make a lot more sense if we pool our dollars. We'll create greater leverage and greater impact.
There are several key findings from the report. One key finding is that the demand for behavioral and mental health services is enormous in Colorado. It's estimated that about 1.5 million people in our state are in need of services. The second finding is that the availability of those services is much lower in Colorado than it is in other states. And the third very important finding is that there are several groups that are grossly underserved: veterans, people in rural Colorado, people of color, and people with disabilities.
The significance was that we all have brought different strengths to the table. So we were able to leverage the strengths of all of us to put together this final report that I think has then led to action. And you know, what's really important is a lot of reports get done, but what happens after the report gets done? Does anybody take it and run with it? Do people pick up the report and say, well, you know what, I can work on this part, or I can work on this part? And that's really one of the goals that we're talking about a lot in philanthropy, is having collective impact. So if we set a common goal of reducing mental illness in the state of Colorado by X percent, then all of us could play a role in that.
The significance of the report is that it really identifies what the issues are in Colorado in behavioral health, identifies some of the evidence base in terms of what works to try to address those issues, and really points to the need for things like integration, additional funding. So it gives us a good roadmap on how we move forward with addressing behavioral health issues.
In our cities and in our rural areas, the overall importance of looking at people where they live and how they live, and what we, and I mean collectively we, can do to improve that is something that is a part of being a part of society.
It was just fantastic to see these four organizations collaborate to try to address a big issue. It really shows that mental and behavioral health is important. It shows that if you work together, you can address an issue. And that's our purpose in even talking about this issue tonight, is how we can collaborate together as they collaborated to make change.
For a person who has a severe mental illness or addictions, we didn't have any great way of helping them. The first piece of becoming a co-occurring capable community is really you have to look at everything you do and you have to say, what do we need to transform?
About 4 years ago, we brought in 12 people who had really high needs in that they had severe and persistent mental illnesses along with substance dependence issues. These are the folks who are living under the bridges, in the parks, that sort of thing. Since then, a little less than half, but not much more than half of those folks have been sober for the last 3 years. I think the most obvious outcome is the money that the community saves by not pouring it into the ambulances and the hospital bed dates, the jail bed dates. In just the first year of this program, and only working with 12 clients, we were able to save the community about $750,000 in just less services going to those clients only. The trickle-down effect is that we have clients who have developed and are developing an appreciation not just for who they are, but for the community they live in.
There were so many things that their assistance helped us with. We are like forever indebted.
Carl is a real leader nationally in the behavioral healthcare field, and so many of the innovations that have emerged from the Mental Health Center of Denver have become models not only nationally but internationally, starting with their strengths-based approach to recovery that is very centered on the consumer, and it can be recovering their education, recovering their career, recovering their family. Most often, at bottom, it's about recovering their hopes, recovering
Dr. Carl Clark has changed the way a lot of people think about mental health. I think instead of thinking of it as we did in years past, as this really dark kind of place to be, I think he thinks of it in a more positive, recovery-based model. And I think when you do that, you're changing attitudes. And I think Carl Clark has changed attitudes in his tenure at Mental Health Center of Denver.
At the Mental Health Center of Denver, we've set a goal of making sure that everyone who lives in Denver has access to mental health care by 2014. We know that's a big task. It's not our goal that we provide all the services, but how can we get our community together with all the providers making this a priority. And then we have great advocacy groups like Mental Health Final in Colorado who are one of our major voices in saying access has to be.
The name of the game these days is collaboration and partnership. We do it in the nonprofit world because there's strength in working together. It's smart. And Dr. Clark has just been an amazing partner of ours through the years, and I think has allowed us to do the work we do and be as successful as we have.